just want to go over a little bit of our PCORI project and some of the findings that we found. We are in Tier 1 of our PCORI, and I'll explain what my research and how I'm conducting it. So PCORI is the funding for human research in coal mines, and here's my project summary. As you can see, we're doing a comparative effectiveness of research of screening in different delivery models in New Mexico miners, and we're using a mobile unit, a standalone clinic, and the University of New Mexico to conduct our research. So the objectives of our project is to assess a real-world comparative effectiveness of 2 different screening delivery methods for miners in order to better inform health policy decisions. Our research approach is to study the design. This is a cross-sectional observation study to assess comparative effectiveness of the 2 screening delivery method interventions among miners. Our inclusion criteria is the study includes New Mexican miners, primarily coal miners and uranium miners throughout the state, who present for screening at either a fixed or a mobile clinic that we have established. Our research approach, our interventions are to compare fixed clinic screening delivery methods, a traditional approach, with a mobile clinic screening delivery method, which is our novel approach among the New Mexican miners. We will establish a network of fixed and mobile screening clinics in New Mexico without any charge to our miners that we see. Our clinics are staffed by trained mid-level practitioners with real-time access to pulmonary and preventative medicine specialists using the University of New Mexico. We employ a comparative staffing pattern and clinical protocols in both screening and delivery methods. Our fixed clinics are held monthly at the University of New Mexico, which is in Albuquerque, Acoma Pueblo, which is an American pueblo approximately 60 miles west of Albuquerque, and Miners Colfax Medical Center, which is a rural community with less than 7,000 residents. 60% of those are Hispanic, and it's in a mineral-rich remote area in northern New Mexico. Based on our previous clinic trends, about 6 miners are screened each time in a half-day clinic. With our mobile clinics, which travel throughout New Mexico, they're held monthly for about a 3-day period in various small communities throughout the state. We see approximately 30 miners in each of those mobile clinics. Our demographics, based on previous data, the distribution of miners seen in those clinics are 25% Caucasian, 35% Hispanic, 24% Native American, and 0.5% African American. And the remainder of those numbers are either missing or not collected. 33% of our miners are less than 50 years of age. 26 are between 50 and 59, and 40% are 60 years or older. Some of the things that we've done in our Tier 1 accomplishments is that we have studied the attitudes among New Mexico miners towards the participation in a clinical research conducted in town hall meetings on one-on-one questionnaires. So some of the things that we've identified are: what adult health problems do you see are most significant in your community? How would you feel about participating in a long-term research study which focuses on these health problems? How would you feel about providing blood and sputum samples? And what would be your concerns if those samples were tested for genetic information? Last question that we've been asking is, what do you think would be the best way to recruit people in your community to join our study? This is one of our accomplishments. We've put together the American Miner social media website. So what we've done is we have created a website which will also link into social media using both Facebook and Twitter, where we can have a group of people come on, ask questions. It'll be real time. We're going to have a blog, and so that's something that we've just done in our Tier 1. Trends that we've identified so far in our study, some of them we were quite surprised by. With the question on what health concerns do communities see, diabetes and cancer are just as much of a concern in those populations as the pulmonary disease that we see. We have found that minors welcome such participation in a long-term genetic testing. Concerns noted by some of the minors that we tested were the accuracy of testing being done and the results that we find possibly affecting any benefits that they may get in the future. Some of the barriers noted was the amount of time and money that it has taken them to travel where the testing is being done. Some of them suggested giving gas cards or milk cards for their time so that they're able to travel a little bit easier. Our Tier 2 outcomes that we're looking towards are an index of new chronic conditions detected, which Dr. Sue touched on a little bit yesterday, minor satisfaction measures with the screening delivery methods, and geographical access measures to be screening on our delivery sites. Using Google Maps, we'll be able to identify actually where their location is. Quite a few of the minors that we see, they don't have physical addresses in some of the communities, so they'll just say they live 5 miles from the Conoco gas station. So with Google Maps, we'll actually be able to pinpoint their locations and see where they're at. With our approach, some of the tools that we will be using and have used are questionnaires that were derived from the American Thoracic Society Diffusing Lung Disease 1978 questionnaire, pre-bronchial dilator spirometry using standard respiratory guidelines, a digital chest film, screening for the presence of chronic respiratory conditions that affect minors, screening for hearing loss using audiometry, and screening for depression using a standard depression questionnaire and metabolic syndrome. So in order to create an index for the 11 chronic conditions that we're screening for, we will create a weighted based and alternatively explore a weighted scale based on the resulting impairment using American Medical Association guides to the evaluation of permanent impairment, 6th edition. We will also use patient satisfaction to be conducted with the screening delivery method using multiple questions with numerical scaled responses in both fixed and mobile clinics. And a questionnaire will be expanded to include questions related to the driving distance between residents and the site of the screening delivery system. Geographical access will be calculated based on geographical coordinates in their residence using the Geographical Information System software and Google Maps. For mobile clinics users, we will calculate road travel times, distances between their residents, and the location of their mobile clinics, as well as the distance between the residents of all clinic users and the closest fixed clinics. Using surface roads to calculate the difference, we will hypothesize that the former distance is smaller and the latter distance is larger than the distance between the residents and our closest fixed clinics for fixed clinics users. Any questions?
So Kandace, how do minors use social media websites? What is your experience so far?
So far what we found is that they use social media websites on the reservations, and quite a few of the older minors at a very limited they have very limited use of them. But one of the things that we're going to do with part of our research study is we have purchased several iPads, and during our intake part of our sessions, what we will do is we will educate them on how to get onto the website. We will encourage them. We've also done some magnets that have all of the information on how to get on, how to access it, and we're really going to play that up as part of our intake forms.
Does anyone else have either websites or social media? Any of the other clinics?
No, at this point in time, we'll be the first ones that do that, and what we're hoping to do is to be able to really branch out using our social media. We'll be able to reach minors here in Virginia, Tennessee, just using that and kind of bring all of the minors together into one social media aspect. Yes?
Question, do you keep track of the coal miners you see as to whether or not they did surface mining or underground mining? I'm just curious.
That is a part of our intake. Our intake form does have quite a bit of their work history and their actual job classifications, whether it was surface mining or not.
Yeah, I'm curious because I used to live in New Mexico, and at that time, York Canyon was the only underground mine still open that can take flow. Are most of the miners you see there doing surface mining?
They are mostly doing surface mine, but what we found is that because once a mine closes, a miner will travel to another area. So, of course, at some time in that employment history, they did have both. So that's why we take such an extensive employment. Thank you.